Okay, so we're here today talking about laser liposuction. Now, laser liposuction is a little bit different than traditional liposuction is that it's done in the office. It's done under local anesthesia. There's no reason to go to the hospital. There's no general anesthesia used. It's just done right here in the office in your own comfort under tumescence anesthesia. So the way it works is that initially people who are interested in liposuction are usually the ones who have a little bit of fat around usually around the midsection, around the love handles. Sometimes women complain about their hips and so on. We're talking about anywhere between 5, 8, 10 pounds, maybe 12 pounds that they have to take off. Something like that can be helped with laser liposuction. Now anything more than that, there's other procedures for, but this is not one of them. Bigger procedures are there for weight loss and so on. Anyway, as far as laser liposuction concerned, you come in, you have a consult with me, I'll go over everything with you in the office, we'll target the areas that you're concerned with, and then once you're all ready to go, we'll take you to our suite and we'll perform the liposuction. So there's a couple of steps in the laser lipo, and the steps are as follows. Initially, after you get prepped and draped, and we mark off your body about specifically the areas we're going to target. We discuss that. We start with our incisions next. We make a couple of small incisions, and these incisions really are approximately 2 millimeters in size. You kind of see that on the screen now. It doesn't really show the size of the incision, but it's really just a tiny stab incision, very, very comfortable. Patients feel really no pain because I numb the area prior to starting to make the incisions. And once they're done, we go inside, and the next part is to numb up the entire abdomen. In this example, we're doing the abdomen and love handles. So we'll take tumescence IV fluid. So here you see on the screen that what I'm using here is cannula, which has just tumescence fluid inside it. And that fluid is really just lidocaine mixed in with epinephrine and saline. And injecting saline into the abdomen with all that numbing medication, what that's doing is it's kind of just filling up this whole area and numbing it up from the inside. So there's, between your skin and your muscles, you have your layer of fat cells, and they're all getting numb with this tumescent fluid. So once that part is done, patient is awake, they're talking to us, they're very comfortable. Most of the time we're listening to music usually of their choice, and so on. So once this part is done, the next part becomes melting the fat. So this is the laser part. So we take our laser and we actually go in through those same incisions. We go back and forth inside to melt the fat that's underneath the skin there. And again, this is completely painless. People are awake and they're talking. And we make sure that they are comfortable. We talk them through the procedure. And if they feel anything, they'll certainly let us know. And all we have to do is just add a little more medication to them. So here you can see the laser is going back and forth, and we're just melting the fat there. After the fat is melted, we move on to the third part of the surgery, which is to actually remove the best part, which is to remove the fat. And this is called liposuction. And the machine I used here is powered-assisted lipo, as you can see there on the screen. The part we're doing is the abdomen. We'll start with that little tiny incision. Now this liposuction cannula is power-assisted, so it vibrates at its tip back and forth. So it makes cutting through fat very, very easy, very painless, and very, very smooth. So you get a ton of fat out in a short amount of time. It's very comfortable, and you get great results. You get a lot more fat out with this power-assisted liposuction than you would otherwise. So that certainly is. I prefer to use that in nearly all my cases. I'll move out of the way here. So the other way, so you can see a little better. That's basically the love handles we're doing there, and that's pretty much it as far as liposuction is concerned. Okay, so I'd like to show you some photographs of before and after pictures, my clients actually who had laser liposuction done. So if you go to my website, metaobesitycenter.com, and you hit that button down there, it says laser liposuction, it'll bring you to the following photographs. You just scroll down a little bit. And right here, for example, this lady, this is one of my patients who had her abdomen. She was concerned about her abdomen and love handles. So we did her liposuction of her abdomen, turned around, did her love handles as well, and that's her result. So she was very happy with it. So that's her before and after. And down here, you can see the love handles. That's her before and after. So I think she was certainly a very satisfied patient, and so on. Next patient down just below, if you scroll down, this is a girl who had a laser liposuction done of her thighs. She was actually very unhappy with the outer part of her thighs, and we actually touched that up, and she certainly was very pleased with the results as well. So hope you enjoyed the video, and if you have any questions, certainly call me or contact us through email, and I'm looking forward to talking to you.